Dr. Elisa Schulman.
John Gerhardt, are you with us?
Yes, I am.
Would you please lead us in an invocation?
It would be my pleasure. Would you bow your heads in prayer with me? Lord our God, as we begin this meeting of our hospital board, we pause to direct our thoughts and prayers heavenward as we seek your direction and guidance here on earth. We thank you for the weighty privilege of caring for those in our community. It is a high honor and a sacred trust to minister to those in pain and distress. And we ask you grant us wisdom to do so with skill and compassion. Bless this hospital board with insight from heaven above as we seek to do so. These things together we pray. Amen.
Amen.
Thank you. Pledge of allegiance, please. I pledge allegiance to the flag of the United States of
America and to the republic for which is one nation under God, indivisible, with liberty and justice for all. John Gerhardt
has left the meeting.
Okay, I have a statement to read. Any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard toward the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital
has joined the meeting.
Contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate the claims at this meeting. Okay. I have one other note before we begin. I want to note that some of our members are attending via teleconference
has joined the
today,
meeting.
and you can see that we are
has
seeking
joined the
to
meeting.
accommodate state and federal recommendations regarding social distancing related to the current public health emergency. We are also continuing to streamline our meeting process to avoid non-essential items from our consideration. With that, I'd like to begin. I ask for approval of the orders of the day.
Yeah.
Any comments? Thank you. I seek approval of the minutes of the meeting of May 18th.
Move. Second.
All those, any comments or questions? If so, the meeting minutes are accepted. Board reports. There are no board reports, but I want to welcome Sarah Lodge to our board. Welcome. Reports of the medical staff. There is no report from the medical staff. We thank all of our medical staff members for everything that they're doing during the pandemic. Turn now to our secretary's report from Britt Reiner, please.
Thank you. Subject to developing conditions, our currently intended schedule is as follows. On Thursday, July 9th, 2020, we will meet from 8 to 11 a.m. The board will have its closed strategic planning session. A court reporter will be there and the transcript will be protected according to the law. On Monday, July 20th, 2020, there will be a finance committee meeting from 9 to 10:30 a.m. from a quality committee from 10:30 to noon. The closed session of the hospital board will be from noon to 12:30. The financial review and board lunch and issues will be from 12:30 to 2, and the board meeting will be from 2 to 4. That concludes my report.
Thank you, Brett. Treasurer's report. Joseph J.D. Virgilio, Treasurer. Approval of bad debt and charity care, please. Joe.
I have a motion. I move approval of the bad debt and charity care for the month
ending May 31st, 2020, in the amount of $22,314,000.
Is there a second?
Second.
All those in favor, please respond by saying yes.
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 Opposed? No, it carries. Thank you, Joe. Our financial highlights by William Volgen, our Chief Financial Officer. Bill?
Thank you, Mr. Chairman. I have the financial highlights from May, and we'll start with the total revenue for the system in the rating agency format. For the month of May, we had total revenue of $79,691,000 compared to a budget of $89,168,000. For fiscal year to date, and this represents 8 months of activity, total revenue of $676,577,000 compared to a budget of $708,417,000. Looking at total expenses for the system in the rating agency format, for the month of May,
Has
total
joined the
expenses of
meeting.
$70,738,000 compared to a budget of $81,584,000. Fiscal year to date, again, this represents 8 months of activity. Total expenses of $628,946,000 compared to a budget of $655,708,000. The system's operating income in the rating agency format for May was $8,953,000 compared to a budget of $7,584,000. The May's operating margin, 11.2% compared to a budget of 8.5%. Fiscal year to date, operating income of $47,631,000, operating margin of 7%, compared to a budget of $52,709,000, an operating margin of 7.4% in the budget. Looking at the hospital statistics, these are May fiscal year to date numbers, representing 8 months of activity. Average daily occupancy, 585 patients, compared to a budget of 580 patients. The average acute length of stay so far this year, 4.43 days, compared to last year's 4.3 days. For admissions, we've had 28,222 compared to the budget of 29,282. Continuing with statistics, the hospital surgery cases through 8 months, 15,400
Has left the meeting.
compared to a budget of 17,490. And for births, we've had 2,549 compared to the budget of 2,524. Outpatient registrations through 8 months, 286,187 compared to the budget of 330,988. Between our 2 emergency care centers, we've had 76,372 registrations compared to the budget of 83,932. And so far through 8 months, our case mix index for all patients has been 1.83, and for Medicare patients, 1.95. Mr. Chairman, that concludes my report, unless there's any questions.
Thank you, Bill. We next turn to committee reports. First, Governance Committee, Joe DiVirgilio, the chair. Please, Joe.
For the short report, the Governance Effectiveness Committee met early today to review the results of our annual board self-assessment. We discussed those questions on which there appeared to be an opportunity for improvement, either through process or education or reevaluation. The committee also discussed whether there was a more effective tool to guide our discussions about self-governance as we move in the future. And the chair has taken on the responsibility to seek alternatives prior to the next self-assessment for 2021. That concludes my report.
Thank you, Joe. Next is Mission and Planning, Greg Carter.
Thank you, Mr. Chairman. Today, Chief Operating Officer Lori Lang and Director of the Cancer Institute, Kelly Batista, gave an update on the Cancer Institute strategic projects. To begin the presentation, Lori reviewed the vision of the Cancer Institute is offering our community the full continuum of cancer care and the planned service locations to meet the goal. Next, Lori and Kelly gave an update on the Radiation Oncology Center at University Parkway, which is Sarasota Memorial's signature entrance into the outpatient oncology market. The Radiation Oncology Center is a board-approved initiative which received approval in January of 2018. The center will include 2 true beam linear accelerators to provide radiation therapy, CT simulation, treatment planning, and patient support services. Next, Kelly presented more details on the center and the preparation leading up to opening the facility. Kelly then shared that the creation of the radiation oncology service line has been a long-term, multi-department effort. The service is currently fully staffed and will continue onboarding throughout the month of June. The staff will undergo a variety of trainings over the next couple of months to prepare for their first patient on August 3rd. The Radiation Oncology Center project will come in online and on budget. Next, Lori gave a brief update on the oncology tower. The oncology tower is also a board-approved initiative, receiving its approval at the same time as the Radiation Oncology Center. The tower will include 56 private inpatient rooms, 9 operating rooms, conference rooms for education and multidisciplinary tumor boards, patient navigation and oncology counseling services, and rooftop cafe. Lori also reviewed the physician strategy and staffing plan for the tower. Construction of the tower is progressing on time and is open in the fall of 2021 within budget. Lastly, Lori reviewed the plans for the Cancer Center at Venice and the Cancer Pavilion. Both strategic projects are in their early planning phases, but are progressing. And that concludes my report, Mr. Chair.
Thank you, Greg. Next is Human Resources Committee, Britt Reiner, the chair.
Thank you, Mr. Chairman. Lori Bennett, Executive Director of Human Resources, gave a report to the board for fiscal year 2020. Mrs. Bennett began the presentation by reviewing the current state of the SMH workforce. She went over the system's volumes, including inpatient and outpatient services and first physicians group. Next, Mrs. Bennett discussed the system's workforce demographics and turnover statistics. She then went over human resources strategy for recruitment, onboarding and orientation, education and development, and retention.
Dr.
Mrs.
Elisa
Bennett
Schulman
highlighted the importance of
has
employee
left the
engagement
meeting.
and the increase SMH has seen in engagement over time.
Vicky Nicewander
In addition,
has
Mrs.
joined the
Bennett
meeting.
went over the system's response to COVID-19. She reviewed the decline in volume that the system experienced throughout the month of March and the plan to rebound and recover from the pandemic. To reduce the effects of COVID-19, SMH instituted a moratorium on all business travel, implemented a hiring freeze, discontinued seasonal and premium labor, flexed and furloughed staff to match volumes, and reduced salaries for senior leaders. In a phased approach, SMH is moving toward rescinding these regulations in accordance with the governor's plan. Lastly, Sharon Rausch, president of Venice Hospital, presented the Venice Hospital staffing plan. Mrs. Rausch first reviewed the hospital's volume assumptions and the proposed staffing plan. Venice Hospital is expecting to need approximately 800 FTEs to meet volume projections. Mrs. Rausch then discussed the hiring, onboarding, and retention strategy. The hospital is scheduled to open in the fall of 2021. That concludes my report.
Thank you, Britt. Next, our president's report, David Barringer, our president and CEO. David?
Thank you, Mr. Chairman. I'm going to start, like I always do, with the organizational report card. We have
Schulman
5 categories.
Has joined the meeting.
Come back and report to the board on. The first being in the area of service. We have our goal of having our likelihood of recommending our number of services greater than 75th percentile being 8 out of our 10. I'm happy to report that we are hitting 9 out of 10 of those services at or equal to the 75th percentile, and I'll show you those in detail in a minute. On the people pillar, We have our turnover of our part-time and full-time staff that have been hired within the past 12 months. We have a goal of being 23% turnover or less. We are just over that at 23.2%. In the quality area, we have a goal of having our combined overall and standardized infection rate being less than 0.90. I'm happy to report that we are exceeding that at 0.71, exceeding it in a positive way, it's 0.71. Just to remind the board members and the public that the expected or the normal rate is 1.0, so we've already set our goal significantly less than the national mix. In the finance area, you heard a report from our CFO motion a minute ago. Our organizational goals have our operating margin at 6.5% or higher. We are projecting our operating margin to be at 6.9%. And then finally, in the area of growth, we have two goals. First being our inpatient admissions and observation outpatients being at 50,000 or higher. We are trending lower than that. 48,821. And the outpatient registrations, we have a goal of being at 930,000 for the year. We are also trending lower than that on that indication as well at 840,000. I would tell you both of these were challenging goals, but they were made even more challenging by the COVID issues that have come up over the last several months. When we look at our patient experience report card at the 10 different areas that we look at for likelihood of recommending, the green column in the middle is our national median score, and then the 75th percentile score to the right, and then ours is in the white. We'll say that we beat everything on the 75th percentile except for the emergency care at our main campus, which came in 1 point below at 83 versus 84. Moving on, wanted a couple different things going on in the hospital, in the community. White coats for Black values at SMH Newtown practice. On June 6th, physicians, residents, medical students, and staff joining healthcare professionals across the U.S. when they gathered to kneel in silence for 8 minutes and 46 seconds outside SMH internal medicine practice in Newtown. The mission of the National White Coats for Black Lives movement is to dismantle racism in medicine and promote health and well-being and self-determination of people of color. Next, we have restrictions on our visitors, which we have started to gradually release. Ease one of the most difficult precautions SMH has had to put in place without COVID-19 has been the prohibition on visitors. As we resume the reopening services, we are easing some of our visitor restrictions in a safe, phased-in approach that includes on the number of visitors, how visitors can go. All the rules are available on smh.com. Any visitor permitted under the new rules must undergo a screening and a temperature check and wear a mask. Each visitor must remain in the patient's room for the duration of the visit. Visitors are not permitted in the Bayside Center for Behavioral Health or Sarasota Memorial Nursing and Rehab Center on Rand Boulevard. And we will review visitor policy and COVID-19 threats in the days ahead and continue to make adjustments to ensure both the safety of our patients, the community at large, and our employees. Virtual celebration of staff achievements. In this time of social distancing and virtual meetings, SMH has transitioned its regular award ceremonies to video. We recently congratulated our latest Ex-Employee of the Month award winner, Diane Freakinese, Administrative Assistant 2 in Women's and Children's Services. Pictured below, right in the center, and the leader of the quarter, Susan Grimwood, Director of Clinical Logistics, Patient Flow, and Observation Services, pictured below left. So congratulations to these. Usually we would bring these folks in and have them get presented in front of the board. Unfortunately, we've now gone to video. Nurse Residency Program reaccredited. Sarasota Memorial's Nurse Residency Program has been reaccredited with a designation by the American Nurses Credentialing Center. The hospital's program is one of only 7 in Florida to achieve the special recognition, national recognition. Accredited programs demonstrate rigorous evidence-based standards for quality. The nurse residents participate in professional development and simulation training. They hone their skills on 1 to 5 nurse residency units before transitioning to the unit for hire. So congratulations to Connie Anderson continue to lead this. First Physicians Group expands our pediatric care. Roshna Gulati comes to First Physicians Group from her previous role as senior physician with Sarasota County Health Department. Board certified in pediatrics, Dr. Gulati has more than 20 years of experience in caring for children. She's an active member of her community and in support of childhood education. Dr. Gulati is also an ongoing participant in the Suncoast campaign for grade level reading and the Born to Read program, in addition to her volunteer work with Healthy Sarasota County's Workplace Wellness Program and her role as a special needs shelter provider. Dr. Gulati will provide pediatric care at the FPG Venice Island office. Okay. 2 other specialists have joined First Physicians Group this past month. Manny Will S. Warren is a dual board certified in endocrinology, diabetes, and metabolism, and internal medicine. He brings an extensive experience and specialized training in the treatment of diabetes and metabolic disease, thyroid masses and disorders, parathyroid dysfunction and bone health, tumors, disease, adrenal orders, and dysfunction. Dr. Warren joins First Physicians Group in endocrinology located on Waldemere Suite 512. We also have Bruce Cecilia, is a board certified in stroke rehab and pain medicine. He specializes in stroke rehab, specialty treatment, myofascial pain, and medical, sorry, the mask is killing me and the words, and medical acupuncture. He also provides general inpatient rehab care and plans for those suffering from brain and spinal cord injuries, stroke, and other neurological, orthopedic, and musculoskeletal conditions. Dr. Cecilia joins First Physicians Group, Physical Medicine and Rehab here at 1700 South Miami Trail. SMH is also gearing up for hurricane season. Hurricane season started officially on June 1st and runs through November 30th. SMH departments are reviewing hurricane plans and assigning staff to the hurricane response team, recovery B team, or the pre-team. All staff and community members are urged to have an emergency kit and plan in place before tropical weather is headed our way. In the event of severe weather threat, look for updates regarding the hospital services on smh.com, social media, and in the local news. Medically dependent people, or MDPs, who require special medical assistance during a hurricane should pre-register with the Sarasota County. Call the county at 941-861-5000 or go to their website. SMH and other hospitals are designated as medical shelters or MPDs, the MDPs who require hospital setting. The county will assign these to appropriate medical shelter based on their needs. SMH Venice construction reaches our halfway point. Despite the challenges to supply chains and uncertainties caused by COVID-19 pandemic, construction continues full steam ahead on the new hospital at Laurel and Pine Brook Roads in Venice. Several representatives from SMH and the construction team recently gathered for a traditional but small and socially distanced topping count ceremony to celebrate a milestone, reaching the building's highest point, which is 82 feet, and marking the pivotal halfway point between in the construction project. In a ritual that dates back 8 times, the construction team signaled the highest beam and hoisted to the rooftop a tree to symbolize bringing life to the building. Construction progress on our Radiation Oncology Center is also moving forward. A temporary certificate of occupancy was issued by Sarasota County on May 1st, allowing occupancy and use of the new facility. Both Lindy accelerators have been installed and commissioned. Our CT simulator has been installed. The grand opening is still slated for July 15th. And the first patient will be seen on Monday, August 3rd. And construction progress on the Oncology Tower continues. Levels 6 and 7 framework and deck work are in progress. Underground utility work has been completed, and the contractor has implemented safety rules for hand washing, wearing face masks and gloves, and distancing while working on site. All employees are monitored daily. And that's my report. I'd be glad to answer any questions.
Thank you, David. Consent agenda. We have
nothing.
Okay, members of the public wishing to make a comment to the board may provide comments to publiccomments@smh.com. This email will open at 12 noon on June 14th and close at 12 noon today on June 15th. Karen, have you received any comments?
We have not.
Okay, hearing none. Now we'll turn it over for legal matters to our Chief Legal Officer, Carol Ann.
Just very briefly, I heard that perhaps the folks on the phone could not hear the vote on the orders of the day. You guys proceeded under the orders of the day, but it would probably be handy for Karen if anyone had any objection to that motion and would have voted no on the orders of the day, just let her know. Otherwise, it will be reflected as having voted or not in the affirmative. Thank you.
Mr. Chairman, I have a point of clarification.
Go ahead.
Could Brett restate the meetings for our July meeting?
Sure, I'd be glad to. There are two. One is Thursday, July 9th, the strategic planning session, which is a closed meeting from 8 to 11. A court reporter will be there and the transcript will be protected according to the law. And then on Monday, July 20, there is from 9 to 10:30, the Finance Committee, 10:30 to noon, the Quality Committee, noon to 12:30, the closed session of the Hospital Board meeting, 12:30 to 2, the Financial Review and Board lunch, and 2 to 4, the board meeting.
At 9 o'clock, it should actually be Joint Finance and Audit Committee. I'm sorry, that's not on there.
No worries. That has been seen from the notes. So let it be reflected that from 9 to 10:30, it's Finance and Audit joint meeting. Thank you, Tram.
Yeah, I want to make sure we knew that. The other thing I would ask is maybe we split those. How long is allowed?
Right now, it's an hour and a half from 9 to 10:30.
9 to 10:30. Okay, thank you.
Any other questions? Any other business? Hearing none, I make a motion to adjourn. We are adjourned. Thank you very much. Be well.
Has left the meeting.
These are really thick.